takes place in a small community pharmacy. What you're about to see may shock you to the very core. A pharmacist, working on what can only be described as an archaic system of beliefs, attempts to defy his store owner by refusing to fill possibly fraudulent prescriptions. Shocking that in this day and age, a medical professional could have anything in mind other than money and a healthy bottom line.
You know the pharmacist is the good guy in the story, right?
Come again?
Yeah, this is a story about acting responsibly and making sound ethical decisions.
Ethics, that's still a thing? Well, all right, color me surprised. All right, from the top. The story you're about to see takes place in a small community pharmacy.
Oh, yeah. Okay, maybe it's best if we skip your intro and see what's happening in the pharmacy.
Hey, Simeon.
Hey.
I wanted to talk to you for a minute.
Okay.
What does this say here about you refusing to fill a prescription yesterday?
Oh, well, it's from that pain clinic I told you about. Same guy came in here last month. I filled it, watched him walk out to the parking lot, hand his bottle of 400 Oxy 30s to this guy in a Harley, who gave him a wad of cash. I mean, come on, they're not even trying to hide it.
In front of our parking lot?
Yeah, right there.
Well, have you seen this month's figures? We're barely staying afloat here. The Walgreens down the street's taking away all our business.
How long can we sit idly by while large chain stores continue to destroy Main Street America?
No, wrong. This is still a story about ethical decision making. What you're talking about is a whole other project.
Unless you have an alternate plan to bring more business into my pharmacy, I'm gonna need you to fill every single script that comes in through these doors.
These are bogus prescriptions, and you know it. This place is a chop shop.
Absolutely not. As far as we're concerned, every single prescription that comes in here is written by a medical doctor. And unless that changes, we are filling every single script.
I have a responsibility not only to our patients, but to the general public. I'm not going to be the one filling the streets with narcotics.
I don't pay your mortgage to have you teach me about responsibility. You will fill every script or you'll find yourself unemployed.
So, Simeon, what are you going to do?
I mean, what can I do? You heard her. If I don't fill these scripts, I'm going to lose my job. And I got a wife and kids at home who appreciate having a house and being able to eat every once in a while.
Simeon, for someone who went to the University of Maryland School of Pharmacy, the best pharmacy program in the world, you sure are acting dumb.
What do you mean?
Well, how are you going to take care of those kids if you're behind bars because of filling bogus scripts? I mean, seriously, Simeon, you need to pull your head out of your...
Good morning, Miss Nichols. How are you doing today?
Good, thanks. Hey, Doc. I'm just here for my Prevacid. How are the kids doing?
A pharmacist caught between his feelings for a patient and his love of his wife and children.
Okay, seriously. Did you even read the script?
So I'm just trying to figure out what I'm going to have for lunch now. Hey, can I help you?
Hey, I got this script here.
Okay.
So how can I get that?
This prescription's for 500 oxycodone 30s. What are you taking these for?
I hurt my back, so I'm gonna take that.
Okay. What did you do to pull your back?
I do care.
Just curious. So we can't fill these prescriptions. We don't have the medication in stock, but you could try that new Walgreens across the street.
Yeah, whatever. Hey, do you think you could give me a ride to Walgreens?
I thought you rode the bus.
Yeah, whatever.
So you just want me to read right from this script?
Yes, read exactly what's on the paper.
All right. This is the moment of truth. What you have just witnessed is our first ethical dilemma. Should the pharmacist give the medication to this man, who was clearly one of the questionable characters from the drug clinic? In doing so, he will be able to keep his job and continue to care for his family. Clearly a beneficent act. That's not a word. However, if the pharmacist gives the medication to the customer, he would also be causing harm, both to the patient and to society as a whole. Thus, he would be practicing maleficence instead of beneficence. Really, I think this is just made up, but two very conflicting ethical principles are at play here. How should he handle this? And how should he handle this to be done in the most ethical ways? Indeed, there are three very important ethical theories, which are called dentology theory, consequentialism theory, and virtue ethics theory. Let's consider dentology first. In dentology theory, the pharmacist will only act according to his duties. You just want me to keep going with this?
Just keep going.
All right, fine. In filling the prescription, the pharmacist would indeed be following the duty of the store manager and his boss. However, Would he be following the duty of a pharmacist? Clearly not. One of the major roles of the pharmacist is to prevent the report drug diversion. If he gives the medication to this shady character, he will clearly violating this obligation and could potentially lose his license. In consequentialism, the pharmacist will act according to the outcome. That is to say, which outcome has the best consequences? What are the potential outcomes of filling the prescription? In giving the patient this medication, what would that do to the patient, to society as a whole? Clearly, it cannot be good. And finally, in virtue ethics theory, the pharmacist's motives are the only ones in consideration. In this case, it would be considered praiseworthy if the pharmacist did not fill the prescription. See, that's what happens when I read from a script. You gotta let me be.
Hey, stick to it.
I can't work like this.
All right, Ms. Nichols, here's your medication. We'll see you next month.
Thank you. See you later.
Bye. Be safe out there.
Hi, I have this prescription I need to get filled.
Hello.
It's for my bone surgery. My doctor said I needed that.
Hey, Percocet 5325, number 40, from the same pain clinic.
Another ethical dilemma for your consideration.
Can you just try to act enthused?
This is
Come on.
boring.
Just do it.
Fine. Another ethical dilemma for your consideration. How should we handle this one? The pharmacist here has thought he'd worked it all out, and now he's feeling the good old tug of ethical dilemma once again. But why? Because the second customer appears to be legitimate, and furthermore, the prescription itself is reasonable, even though the pain clinic she received the pills from is not. Should he once again deny the medication to this patient as he did the last, or should he give her the medication in light of these factors? It seems justice comes into play here. If the pharmacist gives her the medication, is he giving fair treatment? Is he acting beneficently by treating a person who clearly needs the medication, or is he acting justly? Let's find out.
Hey, Miss Matalamua?
You can call me Doreen.
Okay, sorry. If you don't mind me asking, where did you get your surgery done?
At the Shady Grove Orthopedic Center, just down the street.
Okay. Do you mind just waiting a few minutes while we verify your prescription with the doctor?
No problem.
Alright, looks like it checks out. Just give us about 5 minutes to fill this.
Okay, sounds good.
So, I don't understand. Why are we filling this? It's for Percocet, and it's from that same pain clinic.
Yeah, but this patient's clearly gotten bone surgery done, and that's a painful procedure. She's clearly not a drug addict or a dealer.
But I'm confused. Like, this is from that same pain clinic. Aren't we kind of supporting these illegal activities, even if we're filling for a legitimate need?
You know what? Though this prescription's legitimate, I don't think the rest are. I'm gonna call the police on them.
Yep.
Where's your script?
I traded it for these glasses.
And why do you have these glasses on?
For dramatic effect. Here we have a situation fraught with ethical dilemmas. A pharmacist forced to choose between his moral and ethical code. Should he please the money-hungry store owner? Should he act in a just and beneficent way? Was he acting in such a manner when he denied the junkie his pills? Was he acting in the same manner when he gave them to that clean-cut girl? Who knows? What I do know for sure is that had this pharmacist been working in an autonomous fashion, he would have seen that that junkie was clearly in need, and he would have helped him get his fix.
We're losing him again.
Too many of our hardworking junkies are denied their drugs.
Okay, we better wrap this up.
Okay. Well, this has been another exciting story from the wonderful world of medicinal chemistry.
No, this is for ethics class.
Ethics? That's still a thing? Oh well. Good thing though, I have to go meet a man in a parking lot about some pills.
Oh God, no! Just cut. Come on, really, guys?